internal brace. So
Can you please switch off your video? Thank you.
Addition of a non-absorbable ribbon which can protect any ligament or repair or reconstruction is basically an internal brace. It acts as a seat belt, mimicking normal anatomy and providing the protection only if the repaired ligament or the reconstructed ligament is excessively loaded and at risk. So how I do the internal brace? Basically, we do all inside ACL reconstruction in all of my ACL reconstruction technique. The femoral tunnel, mostly I am doing AM portal method for the femoral tunnel with a normal rimmer. We use femoral flip cutter only in the all epiphyseal ACL reconstruction in children, which is C-arm guided. For the tibial tunnel, we always use the flip cutter when the original ACL is not repairable. But normal rimmer is used when one bundle is intact, as the flip cutter is going to damage the remnant of the ACL tissue. So either you can make a vertical cut in the ACL footprint by the blade and put the tibial zig over the split, or you can push the bundle medially to put the tibial zig. Coming over to the internal brace, so fiber tape is to be put on the femoral button first. So it is loaded on the femoral button. It is advisable that you pass it twice, never pass it once. There are the two holes in the tightrope RT and tightrope RTJ from which you can pass the fiber tape. This is a small video. The tip is to keep the fiber tape in tension while passing it. Otherwise, because the holes are so small that you can damage the fiber tape if it is not under the tension. After the flipping of the femoral button, when you do a femoral loop shortening, it is advisable that you keep the fiber tape in tension. Otherwise, the fiber tape will stuck between the button and the bone. So these are the few points and tricks which you can use to have an uneventful surgery. On the tibial side, I always use a concave button. The concave button has 4 holes, 2 for the ABS loop which can slide and 2 for the internal brace. You can use all the 4 holes and then tighten the tibial button. It is advisable to keep the fiber tape in tension, otherwise again it will stuck between a bone and the button. So always keep the fiber tape in tension. After doing the range of motion, the flip internal brace always get some kinks. So it is advisable that you, after the range of motion, you pull the fiber tape to make it straight. Always remember that you have to pull the femoral threads on the opposite direction, otherwise there is a chance that it will flip again into the femoral tunnel. So whenever you are pushing the fiber tape down, pull the femoral threads upwards. Then I fix the internal brace on the tibial side by the shovel lock anchor. In the anchor, first we can put both the fiber tape ends and the tibial button loops. I always take all the 4 threads and we tighten it in in extension or in hyper extension, so that you don't get the post-operative flexion deformity. It's always advisable to keep the internal brace slightly lax than the hamstring tendon. You can use a probe as shown in the picture. In ACL repair, we also use the same thing. In ACL repair, we can use a tightrope RT and loop the fiber tape like this. The fiber wires which are used for the ACL stitching can be tightened up over the femoral button after flipping by the help of an internal brace is loaded on the tightrope RT and fixed on the tibial side by shovel lock. So ACL repair can also be done with the internal brace. Then the post-operative rehabilitation. So basically post-operative rehabilitation is a bit different between the normal ACL reconstruction and when we use the internal brace. In the first 1 to 7 days, we achieve flexion up to 100 degrees. So it's a very detailed, we are not going to go into much detail, just from the first week onwards, we can achieve a complete bending of up to 120 degree of the knee. From the third week, we can start with the squats, closed chain exercises, lunges, and from the third week, we start complete bending up to 130 degree. From the fifth week, we can start with the single leg squats and figure of 8 running and cutting movement, slight jogging can be started from the week 5th. From the 8th week, we can start the running program, which is very early as compared to the normal ACL reconstruction when we don't use an internal brace. So with the help of internal brace, we can start the running and the sporting activity. We can start the sporting activity from the 3rd month of the surgery, not the actually competitive sport, but they can start some kind of rehabilitation according to the specific sports. So this is one of my patient of internal brace ACL reconstruction. As you can see, the bending is almost painless, and in 8 days, 32 days, squats, lunges, everything. This can be achieved fast because we are protecting the ligament by the internal brace, and there is a less chance that it will get lax or loose. So my target is to achieve complete bending within a month, and then we start a bit of jogging after 1 month. Some drills to be added subsequently, and the running program is started after 3 months. So now the patient is running very fine within the 4 months of the surgery. So what is the benefit of the internal brace? Basically, it reduces the post-operative pain. We have operated around 400 patients from 2016 to till now. The VAS score is 1 as compared to the 2 in the global registry if we see in the week 2 and week 6. There is also an improvement in KOS score. I have taken the KOS score on the 3rd month, on 6th month, 1 year and 2 year follow-up. And the KOS score on the 3rd month is 90 as compared to the 67 if we compare to the global registry. There are other studies also in the world like this one, which has shown that there is an improved range of motion, less pain and higher percentage of an early return to the pre-injury activity level without evidence of overconstraint in the suture augmentation in internal brace group. There is one more study by Gordon on the ACL primary repair with the suture augmentation. The ACL primary repair with internal brace ligament augmentation is comparable with the early ACL reconstruction result. So ACL repair is also picking up because of the internal brace. Thanks a lot.